Rodneyse Bichotte Hermelyn, and I want to thank her for being here. And I would be happy to hold Daniel, except I'm not going to try it with today. I would have loved to, but I think I've got a little smarter.
I think so. I'm good. Yeah. He's going to run around. Wow. Good morning, everyone. Thank you so much, Governor Hochul, for the introduction and for doing this for the state of New York and for all of us moms. Good morning, everyone. I am honored to be here at Wyckoff Medical Center in Brooklyn with all of you. Bring greetings to Ramon Rodriguez and the entire staff. I see my Dr. Daniel Foster, my colleagues in government, our board president, Antonio Reynoso, our council members, Sandy Nurse, who covers this area, Councilmember Farrah Lewis, my Councilmember Mercedes Narcisse. I want to thank all the maternal health advocates and experts as our state's first woman and mother governor, Kathy Hochul. That's right. Takes pivotal steps to make motherhood safer by combating maternal health disparities. Our governor, Kathy Hochul, is a steadfast advocate and accomplished leader in taking on the infant and maternal mortality crisis at a critical time. With infant mortality rising nationwide for the first time in decades, while Black women like myself are at threat of dying and keep dying and losing infants at a disproportionately alarming rate. I know the trauma firsthand. 6 years ago, a New York City hospital turned me away as my unborn child was protruding out of me, 3 centimeters dilation, with contractions and other medical complications. And all they did was cite hospital policy. And they said they could not help me nor try to save me. Their solution was to terminate my baby. I was sent here to Wyckoff Heights Medical Center, where cultural competent doctors did all they could to help save me and my son. But my late son, Jonah, passed after being delivered at 22 and a half weeks. I didn't sue. Instead, as you heard from the governor, I took my traumatic experience and turned it into an opportunity to introduce a bill that would prevent those same experiences that I had endeavored from anyone having to experience such trauma. It became law, right? The bill became law in the name of my late son, Jonah Bichotte Cowan, to prevent hospitals from turning away expectant mothers suffering from preterm issues. 6 years later, I decided, when I became pregnant again, I decided to return to this hospital, Wyckoff, a hospital I know I can trust because of its dedicated healthcare workers to deliver my son. It didn't matter if it was a safety net hospital or not. What most mattered was that it was a safe place with workers who truly cared. Wyckoff has culturally competent doctors who truly listen to their patients. And studies have shown that these factors make an enormous difference. And this time around, I had a doula. I was carefully monitored. My iron levels were low, and I was at risk of preeclampsia. I had a cerclage. I was at bed rest. With all the monitoring and precaution, I was still at risk. Because right after the birth of my beautiful son here, Dr. Daniel Jean-Jacques Hermelyn, who's named after my doctor, Dr. Daniel Foster, who's here, who delivered my both sons and saved my life along with other doctors here. I see Dr. Venegas and a whole bunch of, I know Manuel should be here. I had a blood transfusion and surgery for complications. And if I was somewhere else, I probably would not have made it. So from the bottom of my heart, I want to thank Wyckoff Hospital and all of their dedicated staff. These healthcare heroes deserve all the recognition they can get, and I'm committed alongside Governor Hochul to supporting Wyckoff and so many other hospitals and other safety net hospitals. We keep hearing the grim statistics about our maternal health crisis. Our communities are asking for action, and our governor keeps stepping up to the plate. In 2023, Governor Hochul delivered 12 weeks of fully paid paternal leave benefits to more than 80% of the state workforce, signed a law creating the state's first directory of doulas, making them available to all Medicaid enrollees, while signing introduced Mickey's Law to ensure that mothers who experience fetal deaths receive timely treatment. As we start 2024, a new legislative session, I applaud our governor for continuing critical advancements to the maternal morbidity agenda, with nearly $86 million invested in key elements, including expanding paid family leave to cover prenatal care, providing paid benefit for access to prenatal medical appointments, allowing New Yorkers to use doula services without a recommendation from a physician, and reducing the rate of preventable C-section. This is a great new start of the year.